Welcome back. And in today's Black Health Village Healthy segment, we're going to talk about information as it relates to prostate cancer and prostate health. So today's guest, we have Dr. Neal Zeigler, who's going to talk to us a little bit more about what is prostate cancer and things that we can do to help prevent that disease. So thanks for joining us today, Neal. How you doing?
I'm great. Thank you for having me.
Awesome. So give us a little bit of your background.
Okay. I'm a practicing emergency physician. I've been practicing almost 15 years. So I'm not a urologist. I don't treat prostate cancer, but I'm very helpful in making the diagnosis. A lot of times people come to me with a problem. I'll help them figure it out and get them to the right person.
Great. So let's just jump right into it. What is prostate cancer?
So the prostate is a gland. It's located just below your bladder and in front of your rectum. And so the gland, it makes fluid. It's part of your genitourinary sexual tract, so to help you reproduce. And that's about all it does. The problem is it can become enlarged for a lot of reasons, including cancer. And if it becomes enlarged, it causes some problems. So that is one of the challenges between prostate cancer. Is it prostate cancer, or is it an infection of the prostate, which is prostatitis, or do you have an enlarged prostate, benign prostatic hypertrophy or hyperplasia? And the treatment for those things is very different. So it's important to make the diagnosis. Because of its proximity to the rectum, one of the ways we make that determination that you have a problem is a rectal exam. And of course, no man wants to have a rectal exam. But it really, when you put your finger into the anus and into the rectum, you really can feel where that prostate is. And if it feels enlarged, if it has an abnormal texture, then you need some more testing.
Wow. Okay, so as a black man, why does it, or there's many statistics out there. So is prostate cancer really high in the black male community, or is it just something that may be blown out of proportion?
So it is absolutely not blown out of proportion. First of all, prostate cancer is the most common male cancer. Now, you probably don't hear about it as much as lung cancer, colon cancer, because we have good treatment for it. Less people die from prostate cancer than they do from some of the other cancers, but just by the sheer numbers, it's the number one male cancer. And statistically, in African American men, we get it more often than other populations. Asians don't get prostate cancer as much as some groups, but we probably 20% of African American men will get prostate cancer in their life. It's 1 out of 5.
Wow. So what are some myths that are tied to prostate cancer that you can think of?
Some myths, well, I would think that one, people are very afraid of the diagnosis. Cancer is just a fearful thing. People don't want to get tested for any kind of cancer. And so I think one of the biggest myths out there is that cancer is not treatable. Prostate cancer is one of the more treatable cancers. We do have some options. I think another part of it is that you can't do anything about it. Folks think that if you're going to get cancer, you're going to get cancer, but your diet, your health, your general overall health is a big, it has a major impact on your ability to fight all kinds of cancer, including prostate cancer.
Great. Now, I remember my grandfather actually died or passed away from prostate cancer. And one of the myths that I've heard about is that if prostate cancer is related to sexual health. So this was back almost 25 years ago, that he didn't want to have the surgery because he thought it would affect his sexual prowess or his productivity. Sure. Is that something that is true as far as that?
So that is part of the problem. I would say that's the minority of cases, that is part of the problem. Let's kind of go through the process of how you diagnose it, and then we can get to the treatment side so you can see where those problems might lie. So, of course, if you get a digital rectal exam, your doctor's doing a rectal exam, they might feel it, but that's not how we catch it most of the times. Most times we catch it by looking for something called prostate-specific antigen. This is a blood test, it's a simple blood test, and they recommend that most men start getting that test when they turn 50. If you have prostate cancer in your family, if you have other risk factors, they recommend you start getting it early, maybe 45 or even age of 40. And if that number goes up, especially if it goes up quickly, then you need to have a biopsy, okay? And so the way the biopsy is performed, they actually put an ultrasound probe through your rectum, and so they can see exactly where they're looking. They go to the place that looks abnormal, and they'll take a sample, okay? And once you get that sample, they can see, is this cancer? Because again, an enlarged prostate, a non-malignant, non-cancerous thing, is very, very common. And the symptoms are the same. The symptoms are you have trouble making urine, getting your urine out, you feel like you have to pee all the time. Sometimes people have blood in their urine or blood in their sperm. Those are all common ways it would show up, but that can show up with cancer or infection or also with an enlarged prostate. So once you have a diagnosis of cancer, then they stage it. The staging kind of lets you know what your treatment options are. For example, if you have cancer that's localized, it's still within the prostate, hasn't spread anywhere, your odds of surviving that are greater than 99% with treatment over a 5-year period. If it is outside of the prostate, has spread to the bones or anywhere else that's metastasis, then your odds of being able to treat that problem are a lot lower. The mortality rate is more like 28%. So you can see there's a big increase, 28 times or more increase in survivability if you catch it early. So that is one of the things that is really, really important, is you want to catch this early. And now, as far as the treatment, once you know you have that problem, the treatment would involve usually surgery, although sometimes they can plant some radiation seeds right there on the site that can help kill those cells. There's a lot of different options. You would work with your urologist and your cancer specialist to try to figure out what is the best treatment option for you.
Wow. So, brothers, as you can tell from the conversation and what Dr. Neal has been saying, is that, it's something that can be preventable, but we have to take the initiative as far as our health, because we want to be around to see our grandkids and our great-grandkids grow up. So it's all about being proactive in your health and doing what's necessary to continue to live longer. So, Dr. Neal, in closing, we mentioned about how it is treatable and how things can happen. So what would you, if you had a black male sitting in front of you right now, what would you tell him to kind of give him more of a comfort as far as his health and about prostate?
Okay. Well, and I have this conversation with my patients regularly. The first thing is, don't be afraid to get checked. Just like with HIV, you can't treat a problem if you don't get tested, but people are afraid to take the test. They don't want to get the bad news. So don't be afraid to get checked, especially if you're having a problem. Go see a doctor and get checked out. It's easy to do. A rectal exam or a blood test are not that big a deal. And if they're negative, then you got peace of mind. The second thing is eat healthy, get enough rest, minimize stress, all the things that are good for your health overall, and listen to your body. If you are having any kind of symptoms, you need to pay attention to that. There's usually a reason, and most things are treatable or sometimes even reversible. I cannot stress enough how important it is to catch this early. If you catch it early, your survival rates are really, really high. If you don't, you're going to have a bad outcome. And don't be so afraid of the treatment options. The treatment options of surgery, although yes, you can have some men that get incontinence, meaning they urinate accidentally on themselves or have trouble maintaining erection and having sex. Those are some side effects, but they're not that common, and those things are manageable. Everything is manageable if you're still alive to manage it with your family.
Exactly. So, brothers, this has been this segment of Black Men's Digest TV with Dr. Neal Zeigler. Again, thank you for your insight and your input. So how can people reach out to you on social media, or do you have a website or anything like that?
I do. You can find me at pinnacleemergency.co. Same thing on my Facebook page, or you can look me up personally, Neal Zeigler, on Facebook.
Thanks again, Neal. Thanks so much. So, brothers, again, reach out for your health. Strive to live better, live longer, and we'll be back with our next segment again. Thanks so much. This has been Black Men's Digest TV. Have a great day.
Part of the challenge we're having right now is that it's a big money industry.